Come on, 2, 3.
Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Wednesday, January 25th, 2022. And our top story today, why regular dental checkups are important. And joining me now to discuss this and a lot more, Jamie Dudley is with Towson Dental Care. Jamie, it's great to see you. Happy New Year. Thanks so much for joining us on the program this morning.
Thank you, Jeff. Good morning to you and Happy New Year. Thanks for having me.
Yeah, and you know we're into well into 2022, but you know we want to kind of we're working our way down, as we were talking before in the green room, working our way down the human body. We had eyes on Monday. Now we're going to talk a little teeth. Jamie, why is it important for all of us, whether we're young, mature, to get a regular dental checkup?
Well, great question. So I found 4 great reasons why checkups are so important. And the first one being removing the tartar and checking for cavities and preventing tooth decay. That is the reason why you should go in every 6 months to be able to address any issues like tooth decay, and also removing the culprits that create tooth decay, which is plaque and tartar. And you can also get your dental examination where we're checking your gums. All these things are in lieu of helping to put you in a maintenance phase, so you don't have to potentially address things like gum disease and tooth decay.
Yeah, and there really is a link here between dental health. We talked about this before, but I think it's important to just continue to hit on this. There's a link between your dental health, your gums, your teeth, your mouth, your oral aspects of your body, and overall health.
Mm-hmm. Yes, absolutely. That's another great reason to have a dental checkup. One of the things that you will also have done when you come to a dental checkup is we're looking for things like oral cancer screens. We're not just looking at the teeth and the gums for buildup and cavities. We're also looking for signs of lesions or differences in the tissues that should not be there. In addition, we're also learning a lot with current research and tying the systemic health to our oral health. And what we're finding is that the increased periodontal issues, meaning the more gum issues you tend to have, can potentially put you at higher risk or potentially increase current existing conditions, for example, like diabetes or heart-related issues. So our mouth is the gateway to the rest of our body. So keeping chronic inflammation essentially out of the oral cavity is extremely important.
Yeah, I mean, you hit the nail on the head, and you mentioned at the beginning of the segment, the recommendation is every 6 months. And many people have insurance, whether it's through their employer or they may buy separate dental insurance. These insurances really allow for a basic examination, including all the things that you're talking about, and in cleaning.
Yes, for sure. If you are hopefully lucky enough to have a dental policy of any sort, most of them will absolutely cover, especially things like the preventative, the cleanings, the checkups, the dental x-rays to make sure of any potential cavities or lesions. One of the other things that you're also getting included in the price of your checkup is we're looking at systemic health issues. We're checking your thyroid and your neck. We're palpating the lymph nodes. We're looking for all kinds of things that could potentially signal health issues. So you get a lot of bang for your buck when you come in for your dental visit, in addition to your cleaning and exam. So it's a very worthwhile benefit.
Yeah, absolutely. I mean, if it's preventative, I think what I like about it is it prevents higher costs in the future. And I got to tell you, that thyroid exam, it feels really good. When they massage, it actually is a good thing. Before we go to break, real quick, Jamie, what if I don't like pain. I hate pain. I am the biggest wimp when it comes to any type of pain. But what about if I'm a little nervous? I have high anxiety around visiting my dentist. It's going to take an act of Congress, maybe more, to get me in the chair. What do you say to people who have that level of anxiety?
Well, I first say that you are not alone. This is very common for people to experience anxiety when coming in for anything dental related. There are things as simple as being mindful and meditating. Some people say, no way, I need something beyond that. Actually, at the office that I work at, we have a niche department, and we do sedation dentistry here. So we have a large number of our patients who are exactly that. They in no way feel they would be able to come in for any dental exam, let alone a cavity or root canal, without the assistance of some kind of sedation dentistry, whether it's IV or nitrous oxide, or doing more like a pill sedation.
There's really no excuses, Jamie. Jamie, I want to take a quick break. When we come back, we'll talk more about the mental, the teeth, and the body connection. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking this morning to Jamie Dudley of Towson Dental Care. Jamie, thanks for sticking with us this morning. Yeah, this is fun and really important. And okay, you got me over my anxiety. That's great, and I'm ready to make my dental appointment. Let's talk about things I should be doing after the cleaning. So we sit down with you. You've massaged our thyroid, or at least a dentist has massaged our thyroid, checked our oral, our mouth to make sure that there are no oral cancers and all that kind of good stuff. let's talk about brushing the teeth and flossing. How do I become an effective toothbrusher?
Well, effective toothbrushing is a matter of just really paying attention, and especially in the beginning when you're trying to get your technique down. But the most basic and important factors to a good brushing is holding your toothbrush bristles, whether it be a manual toothbrush or electric toothbrush, at a 45-degree angle to the gum line. And you want to do lots of little circles on the gum line. And you want to do this on the cheek, the tongue, the bite surfaces for at least 2 minutes. I actually like to do a 4-minute brushing, one of my brushings every day, which sounds a little crazy, but at least 2 minutes twice a day. And that's the best way to brush. It is going to be more effective if you can use a electric toothbrush. They are designed to help us be much more effective in removing the buildup. The big difference is that we let the toothbrush do a little more of the actual work for us. We are more guiding and holding that 45-degree angle and doing less movement. So that is my big tip, is invest in an electric toothbrush. They're well worth it.
And you don't have to, and to that point, you don't have to like push down. Like, you know, I think a lot of people maybe think you got to get in there like you got sandpaper and scrub, but you can really be gentle. If you got an electric toothbrush, it'll vibrate and do the reciprocations to lift that tartar, but you don't have to be scrubbing your mouth.
That's a really good point, Jeff. In fact, too much pressure and too much of that elbow grease concept scrubbing is damaging to the teeth and the gums. We can easily wear down that outer coating of our teeth, which is enamel. It's harder than bone. And then the gum tissues, things like recession can happen. So it is really, really important to not only have soft bristles, but to also be mindful of the pressure that you're using. Enough to get the point across, but you are maintaining all the tissues in the teeth under them. Yes. So great point.
So if your gums are bleeding, you've pushed too hard. Jamie, where does flossing fit in all this? You know, I love my dental floss. I like doubling up if I have some additional spaces in the lowers here. But where does the dental flossing, I'm giving probably TMI that we've probably turned off at least half the audience, but where does the
this
flossing,
is the fun part.
Where does the flossing, well, it's not good for advertising, but where does the flossing come into this?
Flossing, I feel, is just as important as your brushing is. The buildup that we get around and under our gum lines can be very substantial and very damaging. So you can be the best brusher, but if you're not flossing, you're most likely going to have some kind of gum disease. And so flossing is really important in addition to your effective brushing. And Jeff, I'm sorry, as a hygienist, I have to back up on one thing you said a moment ago. If you're brushing too hard and you're bleeding, you know there's a problem. Actually, bleeding is a sign of infection. So if you are brushing, even if it is too hard, if your gums are not healthy, they can bleed. But if they do not have infection in them, even if you are brushing too hard, they will not bleed. But you will put way too much wear on them. Sorry. Bleeding's a big indicator of inflammation, infection in our world. So,
well, look, I appreciate that. You're the expert. I'm clearly not on a lot of things, but that's why we have you on. Last question, Jamie. Let's talk about nutrition, diet. Are there foods that, they always, growing up as a kid, it was always avoid candy. They tell you that anyway when you're a kid because they don't want you to, just subsist on sugar. But are there things I need to avoid to protect the enamel? Clearly, tobacco, chewing tobacco, those are ixnay, those are out. But what should I be thinking about when I'm consuming food outside of the normal health benefits?
Sure. I mean, generally, things within reason, everything within reason. What you want to look out for with the overall health of teeth is increased sugar in your diet. That is a big factor. Even things that break down into sugars, like your carbohydrates and your breads. If you're going to eat these things, you ideally want to consume them in shorter periods of time and move on. But things that have high acidity, sodas, even healthy juices can have them. So it is a kind of a balance of the pH inside of our oral cavity, but we have to eat and drink every day. So I would say just watching the amount of sugars and acidic beverages or foods that you're taking in are really important.
And I really like what you said, that your mouth is the gateway to your body. You got to treat it with respect, not only your mouth, but your body. Jamie Dudley, we're going to have to leave it there, but really, really, really good information. Thanks for coming on, and we look forward to having you back on the program again very soon.
Thanks for having me, Jeff.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to? Well, drop us a line. And don't forget, for all the information in lifestyle, wellness, tech, finance, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives or see our latest content? Well, check out our website, of course, and our streaming partners like Amazon, Roku, Samsung, and over 100 more. We're back again tomorrow. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink of. But if you're tired, come on.
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.